get started. So, hello, I'm Dr. Azeema Fareed from COMSATS Telehealth, and with me is my colleague, Ms. Farhana Salim from COMSATS Secretariat. We welcome you to this informative session on viral hepatitis organized to observe World Hepatitis Day 2021. We are pleased to have with us Dr. Huma Qureshi, a prominent name in the prevention of hepatitis, with whom we will briefly get an insight on viral hepatitis, its public health implications, and efforts for its prevention and control within and outside Pakistan. We are all aware that viral hepatitis is a major global health problem causing acute to chronic liver infections that put people at high risk of death from cirrhosis and liver cancer. According to WHO, around 325 million people live with hepatitis globally. Owing to the gravity of this communicable disease, World Hepatitis Day is observed every year on 28th July to raise awareness of hepatitis. So this year's theme is Hepatitis Can't Wait, conveying the urgency of efforts needed to eliminate hepatitis as a public health threat by 2030. With a person dying every 30 seconds with hepatitis-related illness, even in the current COVID-19 crisis, we cannot wait to act on viral hepatitis. Viral hepatitis is included as a focal area in the health-related goals, Goal 3, with world leaders pledging to combat it by 2030. COMSATS, being an international organization linked directly with sustainable development in the developing countries, realizes it has a responsibility towards achieving this 2030 agenda. Globally, as the focus of health sector greatly shifted towards COVID-19 pandemic, there is a need to constantly realign the national and international collaborations to achieve health and well-being targets, including those related to hepatitis. Dr. Huma Qureshi is consultant gastroenterologist with prime focus on liver diseases. Recently, she has been retired from government job as Executive Director of Pakistan Health Research Council, Islamabad, and National Lead on the Prevention and Control of Viral Hepatitis in Pakistan. With 148 research publications to her credit, she has been decorated with Tamba Imtiaz and awarded an honorary fellowship from Royal College of Physicians, Ireland. She has held important positions in public health sector related to hepatitis control and prevention. She has also, to her credit, development of National Hepatitis Strategic Framework 2017 to 21 and National Hepatitis C Testing and Treatment Guidelines. Thank you, Dr. Huma, for joining us today. We will now ask you a few questions that I'm sure that you will, after which you will be able to give us good insight on hepatitis and its prevention and control. So, firstly, I would like to have a general introduction to hepatitis. What are its types? And which of these types, in your experience, has been found more prevalent in Pakistan and also in other parts of the world?
So thank you very much, Dr. Azeema, for a very kind introduction. Obviously, good afternoon, everybody, from Dr. Huma to all the listeners and people who are on the Zoom for this discussion. Let me first define what is viral hepatitis. Hepatitis is actually the inflammation or the infection of the liver. So this infection can occur either because of the viruses, or it can occur because of the bacterial infections, and it can also occur because of some drugs like narcotics and other things that people take. But of these three things, the viruses, the bacteria, or the drugs, generally in Pakistan, viruses are the major cause of hepatitis. Even globally, viral hepatitis is very common, but in other parts of the world, the alcohol-induced hepatitis is also very common. So of the there are five virus types which can cause hepatitis, and they have been identified by the English alphabets A, B, C, D, and E, just for the ease to remember. So all these five types are seen all over the world. In some countries, some viruses are more common, and in other countries, some other viruses are more common. So in Pakistan, we have hepatitis B and C, which is very, very common, and they're common, but then they have a problem that once the patient gets affected or infected with these viruses, then it stays in the body. So that's why they're more important, because once it's infected, the disease will remain. So in Pakistan, hepatitis B and C together, they have to date affected almost about 10 million people in Pakistan, which is a very large number. And together, these two viruses cause almost 35,000 deaths every year. So, like you were talking about the COVID, over the 2 years that we have had COVID in Pakistan, there are about 23,000 deaths. And in Pakistan, because of the hepatitis B and C, we see 35,000 deaths every year. So, you can imagine it's much, much more severe than COVID. And if you divide this into the yearly deaths, there are about 90 to 95 deaths every year. And it's a kind of a bad comparison, but I'm just trying to show you the gravity of the situation, that it is almost like a plane crashing with people, loaded with people, which crashes every day, that about 90 to 95 people die every day. So this is the gravity of the problem, that the disease is really, really very serious.
Okay, so we can say that hepatitis has been called this rightly called the silent killer. So, what are the symptoms that one needs to look out for to ensure that they have early diagnosis and proper treatment?
Yes, Azeema, so you very rightly said yourself that this is called a silent killer. And as one can very easily understand, that silent means that there are no signs and symptoms. And when there are no signs and symptoms, then people who get infected with this virus, they just continue to harbor the virus because they have no complaints, and the virus remains inside the body of the person, and then there it continues to grow, and then in about 20 to 30 years lifespan, it turns the disease into a very chronic liver disease, which ultimately results into liver failure and death. So that's why it is called a silent killer, because there are no signs and symptoms. And as I told you, that it can enter through the body, to our in our body, through very, very common procedures, or things that we do routinely in our life, like somebody takes a blood transfusion which is not properly screened, or somebody undergoes a surgery, or somebody undergoes a dental treatment like a filling, a scaling, or whatever, or an extraction. And even like we see our men folks going to the barbers for shaving. So yeah, the same razors are used, and the disease can transmit from one person to other. So all I'm just trying to bring home to all our listeners is that these are very common procedures that we undertake almost every day. So therefore, if you ask me that who is at risk of being screened, or who should undergo screening, to me, anybody who has had received a blood transfusion, who has undergone a surgery, a hospitalization, or a dental treatment, or even having used razors at the barbers, I think they are all vulnerable to infection, and they should all get tested.
So, this means that one should not wait for the symptoms to point out, but if they are in the high risk group, they should seek this screening for themselves, and
Yes,
not wait for the symptoms to come up.
yes, sure.
Okay, so as far as before coming to treatments or anything, how can we prevent? Is there any vaccination or anything for these types, especially the hepatitis B and C, which are more threatening. Is there any vaccination available for them, and how effective is this vaccination? And in countries like Pakistan, do we have a good vaccination status of the population? What is your sense?
Okay, so yeah, there are vaccines available, but not for all the viruses. There are good vaccines available for hepatitis A and for hepatitis E. But as I told you earlier, that both hepatitis A and E are they generally spread through contamination of the sewage water with our drinking water. And there are good vaccines available for these viruses, but they're not generally recommended for our common use to our general population. They're more recommended to be used for people who are kind of visiting Pakistan from countries where these infections are less common. So people coming from Europe, America, UK, they are more they don't have exposure to these viruses, so therefore they are recommended to take these vaccines before coming to Pakistan. But because these both A and E viruses are very, very common in Pakistan, and almost all of us are kind of exposed and immune to it, so therefore it's not recommended to give these vaccines to our common population. For hepatitis B, again, there's a very good vaccine available since almost early 80s. And this vaccine is very, very effective, and it is available in Pakistan, and it's available globally. And this vaccine is given as intramuscular vaccine as 3 shots. If you take one today, then you take another after a month, and the third one after 6 months. So once you have had all three the doses of vaccines, the body develops immunity against the virus, and then one is totally immune for the whole life. So even if there is an exposure, they will be protected. Uh, but for Pakistan, because we have got this high prevalence of hepatitis B also, so there's an international recommendation by WHO that all children who are born all over the globe, they should be given a birth dose of the hepatitis B vaccine. So unfortunately in Pakistan, there is no birth dose of hepatitis B presently. The EPI, the expanded program from immunization, that gives 10 different kinds of vaccines to children before they are about a year and a half old, from birth till about that age. And these vaccines are all procured and given free to each child of Pakistan. But unfortunately, the birth dose is still not included in the expanded program for immunization. But we have been making a lot of noise, and we are trying to push the EPI to get this vaccine into the EPI, because every child must get this vaccine. And if you procure this vaccine through the UNICEF or the Gavi, which generally give the vaccines for children in Pakistan, then this vaccine costs almost like 5 or 6 cents. But if you buy it in Pakistan, then it's anything between 100 or 200 rupees. So you can make that there's a huge difference in the price. So we recommend that Pakistan should get this vaccine from the UNICEF, which is the general vaccine supplier for Pakistan for the EPI. Because that would not only save us money, but it would also ensure that we get the timely doses in a very good condition. So the first dose of the vaccine, if till the time that EPI does not procure it, I would recommend you all to please propagate within your own family circles that the child should receive the first dose of the vaccine, which I told you would not be more than 100 rupees, because the newborn gets half a dose. So if the adult has a full dose of 1 ml, so the child will get, or the newborn will get half a ml. So it should be not more than about 100 rupees. But it is going to really save the life, because then the child will continue to get the other 10 vaccines that he or she is supposed to get, because the single vaccine is just given on the day of delivery, but then all the other vaccines are given as per their schedule. So the child has to receive 3 doses. So the 3 doses otherwise are in the EPI, but the first dose has to be procured right now out of pocket, but once we get it in the API, then obviously it would be much easier, and they would just not have to buy but have to get vaccinated. But something very sad which I'm trying to share with you is that despite the fact that the government of Pakistan procures vaccine for every child and it's free of cost, our vaccination coverage is not more than 70%, which is very, very low. So this is like apathy on our part, that despite the government making things available to us, we are still not happy to take it. And then we are all the time kind of crying that why do we have such a high disease, and what can we do to treat the patients. We have to prevent the disease. And then about the hepatitis C, there's no vaccine globally for hepatitis C. So all over the world, there's no vaccine for it. So all we have to do is prevent the disease. And I told you the prevention is the risk factors, which were like blood transfusions, the unsafe injections, and the infection control in the hospitals. So that's it for the vaccines.
Thank you. This was an elaborate answer to the question. So, those people who are not vaccinated and unfortunately they come to know, or they are diagnosed with suffering with hepatitis B or C, there is a perception, general perception among the population that this is the end of that. It's like having a cancer, that now you're going to die or something. So can you are there any misconceptions in this concept, or do you think that this is the case? And what about the treatment? Because people are very apprehensive with these hepatitis, especially the treatment of hepatitis C, that used to cost a lot. We know that there is now new drug that is much cheaper, but very few people know about it. So again, relevant to this, is government doing something to convey this message to people that this is now hepatitis C is curable and it can be treated cheaply?
Yeah, Azima, as you would recall that previously, when say like before 2014, we all over the world, for hepatitis C there was interferon, that was an injection which was available, and people used to take that injection for about 6 months or maybe for a year. And even and it had a lot of side effects, and despite taking that injection, the cure rate was not in Pakistan, it never crossed 50%. So that was the reason that people thought that oh, if somebody has hepatitis C, that they're going to now live with it and probably going to die with it, because the treatments are not very, very good. But there has been a revolution in the treatment of hepatitis C since 2014. And these new drugs have been produced internationally, and now Pakistan is also producing these drugs generically in here. Locally, they're being produced. So these drugs, these are called direct acting antivirals. Like, these are the drugs that directly act on the virus. So these DAAs, or the direct acting antivirals, are produced in Pakistan, and they're very, very effective. And now the cure rates have gone up to almost 98%. So if we give it to, say, about 100 people, we know that almost 98% would recover, and there might be 2 or 3 who might not recover. So now it's no more a disease where one should be kind of depressed and should think that, oh, that's the end of the life, because and the treatment is also not for a longer duration. The treatment is only for 12 weeks. So in 12 weeks, we can achieve a cure in almost 98% people. This is what I would really like you all to really pass on the message, that we have got very effective medicines available, and the treatment is short. There are no side effects of these drugs or medicines. So the treatment for hepatitis C is available, and it's very effective and affordable. Like it generally costs not more than about 5,000 rupees for the 12 weeks treatment. So it's a treatable disease. For Hep B, actually, sorry, for Hep B, actually not every, like for hepatitis C, if the treatment is mandatory for everybody, but for hepatitis C, not everybody needs a treatment. There are criterias which have to be put in to see who needs it and who does not. And by and large, over 50-60% people in hepatitis B would not need a treatment. They would just carry the virus. And there's a small percentage that needs a treatment. That is again oral tablets. That is again not very expensive, but they have to be taken for life. So the problem is that, a lifelong treatment is always not a good treatment. But for B, it's a very short treatment and very high cure rates.
So these oral tablets, are they available in the government, public sector hospitals
Yes.
and dispensaries and everywhere?
Yes, if you recall that, now each province has a chief minister's program for hepatitis. So this chief minister's program for hepatitis caters only for the treatment of hepatitis B and C. So they have these oral medications with them, both for B and C, and they're freely available, and they're equally effective. So there's another, aura that people think that the drugs being given by the government are not of quality. So I can assure you that these medicines are of quality and they're very effective, but one should obviously go and get tested and then take the treatment. Yeah.
The theme of World Hepatitis Day this year is Hepatitis Can't Wait. Do you think COVID-19 has affected the campaign and efforts to slow down the hepatitis spread? And along with this, same question, continuation, what can we learn from COVID-19 pandemic to fight other diseases like hepatitis successfully and control its transmission?
Yes, so I fully agree, and I've already elaborated to you all that, hepatitis can't wait, because once there's an infection, if we don't treat it timely, then it's going to go into chronicity, and once it goes into a chronic phase, then obviously there are very many complications and deaths. So we can't wait for people to go to complications and die. So the slogan of World Hepatitis Day, that hepatitis can't wait, is very, very timely. And yes, because of the COVID infection, all over the globe, all over the world, things have slowed down. In health sector, especially, things have slowed down because of the lot of pressure of the disease patients who were coming to the hospitals, and then, they were really overburdened. The systems have really collapsed all over the world. But despite all this, we all think that the COVID has also done something good to us. And what good it has done is that it has, at least I can say for Pakistan, I can't say for others, but generally I've heard it's the same, that it has boosted our coordination within the provinces. And you must have all seen that every day we would get the real numbers of how many tested and how many treated and how many cured and how many died. So there's a good coordination within the provinces. It has also significantly improved our reporting and testing capacities, because we could get the reports every day. We could see on the television that how many have been cured. And the testing for the PCR, the PCR machine is the same. So you can use it for COVID testing, you can use it for HIV testing, or you can use it for hepatitis testing. So because of the peer pressure, the COVID testing capacity has also increased manyfold. And because of this, we think that good coordination, good reporting, electronic data reporting, and then the PCR capacity, these four have really gone very, very high up. They're really boosted our health systems. So we think that once the Prime Minister of Pakistan announces the hepatitis C elimination program, which he was supposed to launch in 2019, December, but then that was the time that we got got COVID and we couldn't really proceed further. So once this program is launched, we think that our testing and our treatments could very easily be scaled up, and we could probably eliminate the disease by 2030.
So you plan to have the same sort of the National Commission, the coordination and committee
Yes.
for this COVID. So you plan to have take things for hepatitis on the same lines, like getting
Yes, yes, because that's the success that we saw that the NCOC was probably one of the very active bodies which was able to get the information
yes.
from all the provinces and all the departments, public and private both, because by and large you see that many a times the private sector does not give the information, but this is the first time that I see that there's such a strong coordination between the public and the private, and that's probably through the NCOC, and that is what we have put in even in our program. That once this program is launched, we would really like the NCOC to kind of take it up, because the other good thing is that this all COVID response was tagged with the CNIC, the national identity card of the person. May it be vaccination, may it be disease, may it be testing. So at least we would know that how many have been tested and how many have been treated, and this is actually lacking for all other diseases including hepatitis. So by and large we make assumptions, but we do not actually know what has happened on the ground. So once we link this activity with the NCOC, we will get all this information linked very easily, and the CNIC numbers and all others, and that would ease us in really tracking the people and finding out who has not been tested or who's not been treated.
This is great. So, ma'am, based on the common challenges that developing countries have, they can learn from one another's experience. So, what has been your experience as a focal person of government of Pakistan for hepatitis? Could you highlight some steps that government has taken to eradicate this disease so that our other member countries could benefit from?
So like the challenges, as are many. The first and the foremost challenge is the large population that we have, and as you all probably know, that we are the second country in the world to have the largest hepatitis C burden, and and this large sorry, this large number is because of the large population that we have. So uh, this population, out of the 225 million people that we have, the numbers of hepatitis that we have right now is almost about 7.3 million people who have the active virus and who would need the treatment. So bringing out this 7.3 million people to, and out of these, the statistics show that less than 20% know that they have the disease. 80% do not know. So the biggest challenge is how do we bring these people out to get tested? Because people are all the time waiting that, once they have a symptom, then they will come out. As a clinician, I see every day that people come to me and say, okay, I went for a blood donation and I was found to be positive. But Dr. Saab, I have no symptoms. I'm fine. I'm doing my job. They're kind of reluctant to undergo further testing. So the first and the foremost issue is that how do we bring these people out to get tested? And then those who get tested, unfortunately, are in a phase of denial. They don't want to see that they're infected. So they will go to another lab, they will get another test, and if that lab gives them a positive result, they might even go to a third lab. But if for any reason that labs gives them a negative result, because there are quality issues also in Pakistan. So if they give a negative report, then they would be more than happy. No, okay, we are clear. So they would not be bothered that there might be something wrong with the test. These are and then obviously we are talking about 7.3 million people who would need the PCRs, and then they would need the treatments. So we need to have that kind of money. We need to have that kind of strength in the hospitals and the labs to run this. So these are all things that we have catered in the Prime Minister's program, where the Prime Minister has agreed to do all this testing and treatment free of cost. So this would be this has been catered for every person, that they would undergo a PCR, they would undergo a treatment, but this money has to come from somewhere. And because of the COVID, we got delayed because that money got diverted to the COVID. So we are now waiting that once the COVID is kind of more contained, then we would start the program, and hopefully inshallah once we get it going, then the treatments would start. But then till that time we have this chief minister's program, which is still running in each province and is catering for the population. But because the chief minister's program have limited funds, so they are unable to cater for the whole population in their province. So that was the reason that why we asked the prime minister to kind of do this funding for maybe 5-10 years, and support the provinces in kind, not in cash, in kind, where they give them the tests and they give them the treatments. So then the provinces will divert all their money on hepatitis to the prevention, and they would take up this treatment from the Prime Minister's program.
Okay. So, how confident are you about the level of awareness? Because as I understand that this awareness in the population, in the masses, is extremely important for this disease to be eliminated. So, how confident are you that the population in Pakistan, especially, is aware of this problem, and what more do you think should be done in this respect?
Yeah, so like as it is, you all know that in Pakistan the education is people the literacy rate is low. People are less educated, and even those who are educated, you see there's always a sense of denial in them. So you can imagine that by and large I would probably put in that most of the population is not educated, because if they behave like this, then this is like almost uneducated. And even globally, the problem is the same, that all over the world, not more than 20% people know their status. And so all over the world, all countries are trying to bring awareness to their population by giving them the risk factors, that if you have these risk factors, then please go and get tested. And they're putting in more testing sites at more easily accessible sites to the population, closer to their homes, so that they don't have to travel long distances. So this is what even we are trying to do in the Prime Minister's program, that we are putting in these testing sites at the community level and not in the tertiary hospitals. So we all agree that awareness is very low, and there is a great need to tell everybody that this testing, the initial testing for the hepatitis, is a very, very simple testing, which can be done through a finger prick. And this, like now all over the world, people are doing this testing on their own at their home. This is called as self testing, that you take the device home and you prick your finger with a pricker, and then you put a drop of the blood on a device, and the device tells you whether you're positive or negative. So the first test is this one. And if I give you simple statistics, so say out of 100 people that you will test, there are about 7 or 8 will turn out positive, but 92, 93 will be negative. So this is a huge screening, because to look for 7 you have to screen 100. So this screening has to be done by the people at the community level, close to their homes. But this is like a very, very simple test, where you just prick and put the drop of the blood on the device. As COMSATS, as an institute, with the university, with the electronics, with media, everything with you, I would request that I think from your forum, if you can push this to people, that get the simple test first, so that at least they know their status. Those who are negative, they don't have to do anything. those who are positive, not everybody would be diseased, or not everybody would have the hepatitis C. They would need further PCR testing, and once they get the PCR testing, then out of the seven, about six or five would be positive. So again, not all HCVs would be the persons who would need a treatment. So there's a need to make create awareness about this disease, and I think as COMSATS, you can engage the universities and the colleges to become leaders for creating awareness about the disease in their households, within their communities, within their own groups. And obviously they can, once those who are found positive, they can then obviously let them know that they can go to the nearest hospital for their further testing and treatment.
So, in the end, Dr. Huma, would you like to, if I may have missed anything, you would like to add anything? Before that, I would like to know the experience of yours as a national hepatitis C testing and treatment guidelines. As I understand that you have prepared these guidelines both for Pakistan and Afghanistan. So, what was the experience in that? What was your experience?
Okay, so like we have WHO is actually the organization which develops the global guidelines. So those are the guidelines that one has to follow, but then you have to tweak them to your country's use or country's need. So we obviously also use the WHO guidelines for hepatitis C testing and treatment, but then like the different types of hepatitis C. So in Pakistan we have a different type. So we kind of tailored the WHO guidelines to our needs. So this is a very very good experience actually, because then we call people experts from all the provinces, the program managers, the health department people, the experts, and then we have a consensus over 2-3 days about on each and every point that we agree and the reasons why we disagree, because it's not like I may agree or I may not agree. We have to scientifically prove. So everybody brings in the scientific proofs, and then those scientific proofs are sorted out, that whether they're really of great strength or they're just like just a write up with no scientific background in it. So using all those informations, we develop the guidelines, and then they're also shared with the WHO, so that if at any time we miss something, then they always kind of guide us that you have missed this thing, or you have added this thing, or you have to add this thing. So development of the guidelines for Pakistan was is always a good thing for us. It's always very exciting, and in fact we are going to and develop the new guide we are revising the guidelines again in 2021, because the new drugs are coming, new treatments are coming. So they're all oral treatments, but they're much better than before. They have much smaller, like I told you that currently the treatment is for 12 weeks, but now the new treatment is for 8 weeks. So we are going to revise these guidelines as we get new drugs registered in Pakistan. But in the time the new drugs are not registered in Pakistan, there's no point in revising them, because we can't put the drugs which are not available here. The development of the guidelines in Afghanistan was a real challenge because of many reasons. First of all was that they don't have the medicines available there in Afghanistan, and most of the medicines are, some go officially and some go unofficially from here to Afghanistan. And then is the medium of discussion, or media, their language is generally either Farsi or their own language, and it's not English, or it's not even Urdu. So by and large, you need to have an interpreter to kind of really tell everything, so that takes quite a bit of time. But then they were very receptive, and they were very agreeable. And we did these almost about 2-3 years back. And last time I met, and now they've really kind of now they have understood, how to do it. So last time they said that now we are treating the patients very well and they're really improving. So at least we were able to push them out of that interferon business, because they were still procuring interferon and giving it, which was much, much more expensive and less effective. Yeah.
Thank you, Dr. Saiba. And would you like to add something in the end?
Yeah. So, and then, by the way, that was not a remote meeting. I had to go to Afghanistan to do it.
Okay.
So yeah, I think the last message that I would like you all to take up is that as young people, as young people like you all, and your students and your college and university group people that are there, that we all can do something. It's not the responsibility of the health department only to kind of bring people out, get them tested, get them treated. There are many ways. First of all is the behavior change, that that we have to change the attitude to take injections. Like I told you that in Pakistan, we have a very, very high demand of getting an injection for any ailment. If there's somebody has a headache or a body ache or a fever or a fatigue, they will go to a doctor and ask for an injection. So Pakistan, like all over the world, not more than one, two, or three, or maximum of 5 injections are allowed every year for one person. But in Pakistan, this number is almost about 13. So we rank the highest country in the world with the highest number of injections being taken for common ailments, not for diseases. So again, this is a behavior change, that we have to tell people that there are orally effective medicines available. We don't have to go to for injections, and if there's a need to go for injection, then they should go to hospitals and take it from there. Because if you go and take it from the clinics and the general practitioners and the non-registered practitioners, there's a very high chance that these injections and these syringes might not be that clean. They might have been reused in somebody else and are reused in them. So this is a behavior change. Then asking people to go to shave at their home and not go to barbers is again a behavior change. So you should try and engage your people in developing behavior change messages, because behaviors take a long time to change. So we have to develop these kind of messages which are easy to understand, easy to adapt, but still it would take time. And these messages have to go on and on with different contents in it, so that people don't get bored with them. They continue to stick on to them. Then we can obviously, as I said earlier, that as an institution you can involve other institutions within your own city or within your own country. You can have WhatsApp group or something, like where you can have these joint discussions about the disease and how we can prevent it and how we can help people to identify them. Similarly is developing a kind of a software. Many a times people say that if I am found positive, where do I go? So you could tag the health facilities close to their houses. So we could say that okay, using the Google Maps and other applications, one could tag on these health facilities for the ease of the people, that okay, the closest facility is there where you can go. And then obviously for hepatitis B, as I told you earlier, that we have to really make a lot of noise of to all our children, or our parents, who have these young children or who are young moms, that they should get their children vaccinated through the expanded program for immunization, because that is done free of cost, and that has all the vaccines which are really good. And the birth dose of hepatitis B should be given to every newborn child on the day of delivery, because that is again very important. And then last but not least, we have to let the people know that hepatitis C now is treatable, curable. with the oral treatment, which one has to take for 12 weeks. So not a big deal, but they have to come out and get tested. Thank you.
Thank you, Roxaba. Now I would like my colleague to just formally thank you and wrap up this interview. Ms. Farhana
Dr.
Salim.
Huma Qureshi, it has been a pleasure listening to you, and it was very informative. And we are very aware that you're in between things and you made time for this meeting. We are utterly thankful. Your lecture not only has enlightened us in general and through different media, social media, and the website and newsletter, that it'll be becoming a part of, will also take awareness to a lot of other countries as well as within Pakistan. And that helps us with the cause of advocacy of key issues that are hitting very close to home when it comes to advocacy of sustainable development and use of science in general for the developing countries. I would like to thank you for this, for making time for this, and for giving such a comprehensive and useful and informative overview of this disease that has been, as my colleague quoted earlier, called the silent killer. And let's hope that with this awareness session and your kind, elaborate discussion and your detailed answers, people who will be viewing this interview or reading it in our other media will be a little more cautious and a little more alert towards this, and hopefully that will also overall lift the burden related to this disease and other diseases that are emerging and taking a toll on the already burdened health sector in the developing countries. I'm just very obliged for you to make this happen today. Thank you so much.
Thank you. Thank you very much. Thank you. Really great.
Thank you, Dr.